In this lecture, we will discuss nonspecific intraventricular conduction delay, including its EKG features, potential causes, and clinical significance. Nonspecific intraventricular conduction delay is defined as a prolonged QRS interval that does not meet the criteria for left bundle branch block or right bundle branch block. Therefore, actually noticing it on the EKG may be rather subtle because we're not seeing any of the wave changes, but instead we're just seeing a widened QRS interval. So just to go over our QRS interval, okay, here's our complex. This is our P wave, our QRS complex, and our T wave. Our QRS intervals from the beginning of our QRS complex to the end of it, okay? So that interval there, normally in adults, is between 70 to 110 milliseconds, okay? About 2 to 3 small boxes, all right? And in this case, it would be widened. So if we look here at our complex here, notice that here's the beginning of our QRS complex, there's the end of it, and in this case, it's 4 small boxes. And 4 small boxes is 4 times 40 milliseconds, or 160 milliseconds. So you can clearly see that's widened. Everything else there seems normal. Our P waves are same morphology, our PR interval is normal. We have a normal rate going on here. Okay, so other than that, it's just our QRS complex is wide. Now the QRS durations vary based on age. For adults, it's defined as greater than 110 milliseconds. For children between 18 and 16 years of age, as greater than 90 milliseconds. And for children less than 8 years of age, as greater than 80 milliseconds. Okay, so what are some causes of this? Well, nonspecific intraventricular conduction delay may be seen after large myocardial infarctions, such as in the region where there's now necrotic tissue that's taken over. Other causes that may cause this without changes actually in the QRS complex appearance, meaning just widening it and no waveform abnormalities, would include myocardial fibrosis, amyloidosis, dilated cardiomyopathy, and ventricular hypertrophy. You may also want to make sure you rule out the other causes that may cause wide QRS complexes, such as WPW syndrome, pacemaker stimulated beats, Brugada syndrome, arrhythmogenic right ventricular dysplasia, also electrolyte disturbances. You know, the common one, hyperkalemia, as we've been seeing, causes these wide complexes. Medication effects, such as with TCA overdoses, among many others. Lastly, it may be simply a normal variant in some individuals. Now, clinically speaking, while this may seem like a small detail to consider looking for, studies have indicated that patients with this nonspecific intraventricular conduction delay are at greater risk of all-cause mortality and cardiovascular death, especially arrhythmia-associated deaths. So while it may seem trivial, make sure to look out for it and consider the other causes that we mentioned above for the wide QRS complexes. All right, let's briefly review what we discussed before we end here. So again, nonspecific intraventricular conduction delay, okay? What you're looking for is pretty much a wide QRS complex. Notice that it varies in adults, children 8 to 16, and then less than 8 years old, okay? For adults, we're looking for a greater than 110 milliseconds. For 8 to 16 years of age, greater than 90, and then less than 8 years old, greater than 80 milliseconds, okay? Now the criteria, we also don't want right bundle branch block or left bundle branch block. They must not be met, okay? So pretty much when we talk about intraventricular conduction delay, it just means that there's slow conduction within the ventricles, intra, okay, meaning within the ventricles. So we're going to see these prolonged QRS intervals, but we're not meeting the criteria for any of these other right or left bundle branch block, okay. We mentioned a number of causes here, okay, that are listed, and you should make sure you're aware of them. And remember, this is clinically significant because these patients are at an increased risk of all-cause and cardiovascular mortality, okay, and the mortality is often arrhythmia associated, okay. So make sure to consider the causes that we mentioned here, and there's many others that you should be aware of. And lastly, you may be wondering about this image I placed here. Well, these are the expressions I hope you're having as you're finally beginning to understand EKGs. On a more serious note, I'm really proud of you for getting this far in the course, and you should really be proud of yourself. Putting up with me for this long is a task in itself, so thank you and great job. The end is in sight. Well, that's the end of this lecture. We discussed nonspecific intraventricular conduction delay, including its EKG features, potential causes, and clinical significance. I hope you learned something.